All right, hello everyone. You're listening to Unidos Unplugged, the podcast where community culture and wellness take the spotlight. I am your host, David Berreal. I'm the outreach specialist. I am joined here with our director, Moises Arjona.
Hello.
And we are joined by Mr. Juan Aguilar today.
Hello. Thank you, Moises. Good afternoon, everyone.
All right, awesome. And if you want to just tell us a little bit about yourself, Mr. Juan, and just give us a little bit of background on you and what you do.
Absolutely. Thank you for having me here. You guys, thank you to Unidos contra Diabetes for hosting me here today. Currently, I'm an LVN. I work with Su Clinica. My name is Juan Aguilar. I've been a nurse for 18 plus years now. Currently, right now, I work with Su Clinica in Harlingen. I'm a diabetes educator. Some of the things that we do there at the clinic is we do a lot of teaching to our patients in our community that have diabetes. We do have several programs. We do have the Diabetes Self-Management Educational Program. We do have a DPP, the Diabetes Prevention Program, and we have Color Your Plate. So those are the programs that we have that we offer at Su Clinica. I currently run the Diabetes Self-Management Educational classes that we run at the clinic. The classes are once a week for 10 weeks. They're about an hour long. So, the criteria for that is the patient does have to have diabetes as a diagnosis. They have to have their A1C above 9. If they also have to have a new medication. If they've already attended our program, they have to have a new diagnosis to qualify again. So our main goal is to lower their A1C. And there's a lot of benefits. There's weight management, weight loss program that we also incorporate into the diabetes classes. We also check their blood pressure every time they come. So there's a lot of benefits. There's weight loss, there's cardiovascular management as well. So there's a lot of benefits. We talk about nutrition, exercises, the chronic complications that come with diabetes. So
Right.
a lot of the patients that I do get are chronically ill with diabetes.
Yeah. So before actually we dive into more of the DPP programs and all the stuff you do there at Su Clinica, I was actually curious to ask you, what made you decide to become a nurse?
Well, believe it or not, ever since I was a kid growing up, my parents, the way I see it, is they took care of me when I was young. And I wanted to, take care of them as they get older and they've gotten older. I want to be able to care for them. So that was my main goal was, I want to care for my parents. They cared for me when I was a kid, so I want to care for them. And then I just saw, well, if I can care for my parents, then I can care for a lot more other people too. So
Right.
I went into nursing knowing that, a lot of people say, well, there's money in nursing, and there is, but you got to have a passion for what you do. So, and you have to have that compassion for helping people out. So I love to talk to people, and I like to be around people, and that's just one of my main goals is to help people live longer, and that might be through teaching. It might be through educating them on their medication, their diagnosis. A lot of patients don't understand the language that most medical professionals use. So that's where the nurse comes into play, and they explain it to them in the simplest words. So I feel like it's my calling to help these people out.
Awesome.
Cool.
Awesome.
Cool. Yeah. So again, you touched on a lot about DPP, diabetes prevention programs, diabetes self-management programs, DSME. So we use a lot of acronyms in diabetes prevention work and stuff. And then you use the other one, Color My Plate.
Color Your Plate. Yeah.
Color Your Plate.
Yeah.
Tell me more about Color My Plate. What is that? What is that?
So Color Your Plate is a program. It's one of our newest programs, actually. My partner Elias and a former colleague of mine that no longer worked with us, Edgar Garcia, they were the ones running that program. Now Elias is running it. What Color Your Plate is, it's for the non-funded patient that the clinic has. And what they do is there's several classes that they give to encourage the patient to eat more fruits, eat more vegetables. They talk about the benefits of the natural color of the vegetables and fruits, what they do for the body. So the importance of that. A lot of the patients, they don't know, the importance of eating fruits and vegetables. That's where our majority of our fiber comes from. So you're looking at 70, 80% of the time that we eat fruits and vegetables, we get a lot of fiber from there. So there's a breakdown. I'm not really familiar with how many sessions they have, but because that's one of our newest programs. But it's a really good program. They have a lot of participants, anywhere between 50 to 60 patients.
Wow, that's great.
Per clinic. So we have 4 clinics. So our biggest clinic is Harlingen, then you have Brownsville, and then you have Raymondville, Santa Rosa are usually kind of grouped together.
Okay.
But my partner Elias Flores is the one that's running that program currently right now.
Yeah, so I was talking to someone earlier this morning about just in conversation, because I always wear my shirt and the logo, and they're like, "Hey, you work with diabetes?" I'm like, "Yeah," and so we start talking about. I go, my deal with them is, what type of sugar addict are you? And he's like, "What do you mean?" And I'm like,
Yeah.
"Do you drink your sugar or do you eat your sugar?" And he's like, "I never thought of it that way."
Yeah.
I go because I eat my sugar.
Sure.
And then he says, "Well, you know what?" He goes, "I love fruits." And I go, "Don't tell me mangoes, watermelons, and all these types of stuff." It's like, "Yeah." And I go, "Okay, well,
Yeah.
what about the blackberry, the blueberry, the strawberry, and all this other stuff?" He goes, "Those are expensive."
Yeah, there's a misconception, and here's the thing: what patients don't understand is, those ones that you mentioned, blueberry, blackberry, all fruits have natural sugar.
Right.
But the ones that you mentioned have less. So the ones that a lot of patients go for are the mango, the watermelon, the banana, the piña, the more sweet type of flavors. So there's just a level of education that they don't understand, and you got to just explain it to them and educate them, because they tend to think, well, they're just more expensive. If not, you think about how much does a bag of potato chips cost nowadays?
Right.
$5, $6, $7.
Yeah.
You can buy a lot of fruit and vegetables for that amount of money too.
Yeah.
It's just that it's all about priorities and choices. But I think naturally, people just have a sweet tooth.
Right.
And-
That's exactly what I was gonna say. After talking to him a little bit more and stuff, I realized that he has a sweet tooth. That's
Yeah.
why he gravitates to the sweeter. It's not
Yes.
the cost. I was
Yeah.
like, bro, I go, what's happening is you're gravitating to the sweetness. That's what your deal is.
Yes, you put a lollipop in front of a child, and then you give him something sour. He's gonna say, "Oh, I like this one." So
Yeah.
it's just our natural instinct
Right.
to go for the sweet.
Yeah, and I think it's part of our culture too.
It is.
Everything in our culture is we have our morning meal, and then we look for something sweet.
Yes, absolutely.
Same thing for dinner, right? I remember my dad like wanting something with honey and nuts at the
Yeah.
end of the meals and stuff. So
Absolutely.
it's part of our culture. I think
Yes,
and it's
yes.
hard to change our culture and our mindset that way sometimes. So that's cool.
Yeah.
And the other thing about so now talk about fruits. Let's talk about the vegetables, the ones that nobody really wants to eat at all.
Right.
And I always tell people the joke, how many of you eat broccoli? And no one says nothing. I go, how many of you eat broccoli and cheese? And they all raise their hand. It's like, okay, well, now
Yeah.
you're not doing the rightest thing there, right?
So with vegetables, we have a lot of patients, especially our Hispanic culture, they're just not used to it. They didn't grow up with it. Think about, me being Hispanic as well. My parents really never focused on the vegetables, much less the fruits. But more on the vegetables. Think about the only time when people really actually eat vegetables, especially in our Hispanic culture, is you get a little northern
No. El caldo.
caldo, right, with elote, and you get the corn and the potatoes, which is those are your carb starches,
Yeah.
and they're not the best vegetables, but that's really what they consider vegetables,
Right.
the carrots and stuff like that. But I'm talking about eating more green, the spinach, the okra, the broccoli, the kale, the cucumbers, avocado, stuff like that. Not that corn is not good. I'm just saying that's
It's a
what they
quantity,
consider
right?
vegetable.
It's
Yeah,
a
it's a quantity, right? Correct.
Yeah, and I think it's really hard, when we talk to people, because David and I go on talking to people and we do our trainings and stuff, and we always tell people, here's what my plate says your plate should look like, and then we ask them, what did you start eating first? And they all say they're carbs first.
Yes.
And I was like, no, eat your protein and then everything else, because once you eat your protein, you're going to feel a lot fuller too, right?
So in my program, the DSME, we go over the plate method a lot. We introduce it the first class period, and then the first class, and then about midpoint, about the fifth class, and then we mention it again before the session 10th class ends.
So on that note, Mr. Juan, if you could maybe for the listeners here, I'd love it if you could give us a rundown of. I'll use myself for example. Let's say I go to you and now I have to go through these DSME classes or anything like that. How do you kind of deal with the patients? You're getting a brand new patient coming to you. They sit down and you just kind of take me through that process of kind of where you start with them and where you take it.
So in order for me to receive a patient, there's an order, right, for them to start classes with me, diabetes self-management educational referral. That's been given to them by their doctor. My job is to make sure that they have diabetes, they meet the criteria. right? So once they come in, we schedule an appointment. I let them know, look, these are what you're looking at. You're looking at once a week for 10 weeks. Classes are about an hour long. So we schedule an appointment, and then they come in. We give them a registration packet because that's part of the process. They have to fill out their clinical history, stuff like that. And then we give them a pre-quiz. I want to see where their knowledge is about diabetes. I want to see what they know. A lot of them don't even know what type they have.
Yeah.
Some of them leave it blank. It's either type 1, type 2, or gestational diabetes. And a lot of them leave it blank. Some of them don't.
Wow.
They don't know what I'm asking them, and they're just simple questions, yes or no. Are there 5 types of diabetes? Well, there's only 3, but some of them leave it blank because they don't know.
Right.
So, so I'll talk to the patient once they give me the registration packet. I'll let them know, look, every week you come in, it's a different topic regarding diabetes. First class is going to be an introduction to diabetes. We're going to throw a lot of stuff at you. It may seem overwhelming, but it's good stuff. Class number 2, we'll talk about the chronic risk factors for diabetes, and we'll dive into the 3 types of diabetes a little bit more with a deeper dive in those areas. Class number 3, we talk about what is diabetes doing to my body? How is it making me feel? Am I depressed? Am I anxious? Am I sleepy all the time? Do I have a lot of energy? Class number 4, we talk about exercises, the importance of exercising, the excuses people make
Well, yeah.
not to exercise, and then class number 5, I let them know, look, we're going to talk about the foods, the benefits of the eating the proper nutrition with fruits and vegetables, and what the natural color does for your body. Class number 6, we talk about reading food labels and portions. Class number 7, we talk about other things that incorporate into diabetes, like home remedies and certain medications that they're used for diabetes. We talk a little bit more about insulin and the administration. Class number 8, we talk about all the people involved in taking care of a patient with diabetes. Class number 9, we talk about the silent killers. A lot of patients don't understand how come they don't feel the oncoming symptoms of a heart attack or a stroke. Well, their nerves are shot because their diabetes levels are so high, it kills the nerves. So we introduce them to a lot of things. It's a lot, but we break it down. So when I get a patient, I let them know, okay, when you come here, it's going to feel like a lot, but I'm here as a resource. I'm here to answer your questions. I may not know everything, but I got a lot of experience doing this. So I make them feel where they can get comfortable. I gain their trust as well.
Does it surprise you how much some of these patients, I know you've been doing this for a while now, but do you still get surprised about how little they know?
I do. It still surprises me. A lot of the times, they go see their doctor. Their doctor doesn't really explain to them. They get the most from us as nurses, as educators. You don't have to be a nurse to educate somebody, but you do have to know about what you're talking about as well. But most of the doctors that, they follow up with, they've got 2 to 5 minutes tops with them.
Yeah.
And they got to go over their medications and everything. With us, that's their opportunity to ask every possible question. And usually the majority of the time I answer their questions, and any questions that I can, I say, look, I'll get back to you. Let me ask your doctor. I'll shoot them a message through our portal and our EMR, and they answer me right away. But a lot of them do sometimes, come in and they're like, they just don't know. So they are learning as they're going. And they've had diabetes for quite some time now.
Yeah.
Some of them didn't even know they had it till they followed up.
Right.
And so it's a barrier for us. It's quite a challenge.
I think the challenge also becomes, again, as you mentioned, gaining their trust.
Yeah.
They see the white coat syndrome. I know we culturally, we respect people in uniforms.
Yes.
I love that you all dress down a lot, the nurses in their education. And by when you dress down, you're able to wear a normal t-shirt and stuff to make yourself like you're one of us, right?
Sure.
And when I say one of us, it's the patient, right? Because, I still go somewhere and I see someone in a uniform, I feel like, I have to act a certain way. I have to, there's... treat them a certain way and not ask certain questions because they're busy people, right? So I think gaining their trust is really, really key once they feel that you are just like them and they can ask those certain questions that maybe they're afraid to ask a doctor because they don't want to feel like they don't know something. And the worst thing for us is, and I say this culturally, as a prideful people is we don't want to sound stupid for anybody or ignorant.
Yeah.
Or anything, right?
And in the program we have, the DSME, we're American Diabetes Association certified. Everything we teach is off the criteria of the American Diabetes Association website. So everything that they're getting is the most late updated information.
That's good. That's great.
So-
And I think one of the things that I know David was alluding to and talking about what the whole deal is and how you learn, I think a lot of people that we encounter ourselves talking to is they start, well, I started with type 1 and now I have type 2. And I go, no, you never started with type 1
Yes.
and type 2.
We get a lot of that.
Yeah, you either are that type 1 because that's an autoimmune, and type 2 could have been prevented with exercising and healthy eating. So, right.
Yeah. We give them a lot of statistics also on, how they end up with diabetes. I always tell my women patients, if you had gestational diabetes, more than likely you're going to have type 2 in the future. It doesn't have to be that way, but
Right.
statistically it is.
Right, right.
So we give all our patients a lot of paperwork, handouts, material so they can take home for reference. So that also helps them too.
Cool. So what do you find that works really great in your classes? I mean, I know that, we're still adjusting to a world after COVID.
Mm-hmm.
Before COVID, people wanted to get together and stuff, and now people are a little bit more cautious. And even though we know COVID is not going to go away, it's still around, you get colds, flus, sinuses, whatever the case may be. But what are you seeing now that works for you all to get people to be engaged or your patients to be engaged?
I think just bringing that awareness to patients, a lot of visuals. We give a lot. When I teach my classes, I don't want to be hammering somebody, say, look, if you don't take care of yourself, you're going to lose your foot. That's not the way to do it either.
Right.
But we do touch on certain topics that, like in class number 9, we talk about the silent killers. I go into the possibilities of having a stroke and a heart attack, not because your heart is the issue. Diabetes, the sugars causing all of this, right? So we go over the chronic complications in class 2 and just say, look, have you ever heard of a family member, maybe loved ones that you know of that have lost their vision due to diabetes? Maybe kidney damage, dialysis, people losing maybe their toes. And, so once I start to engage with them on that, they start to take like really serious, like, oh man, I better keep coming back to these classes because I'm learning a lot.
Yeah.
So, but you have to captivate your audience. Back 2 years ago, we used to do groups, but I would have a group of 5, 10 patients sign up, and then only 5 or 6 would come to the first class. And every class that would go after that, it would be less and less and less.
Yeah.
So now the criteria has changed. So now we're doing individual classes,
Okay.
and I seem to be retaining my patients more.
Right.
They're questions that are one-to-one kind of thing. So that also has brought my patients to keep my census up par. I see about maybe anywhere between 22 to about 30 patients monthly.
Oh, that's great. I think you mentioned there's something key right there. When we're in a group setting, sometimes if we don't really feel comfortable or we click with everyone,
Yes.
people just don't feel comfortable asking questions and participating. They become, they just dwindle. It happens in school too, right?
Right.
You know that the people that sit right in the front, they're going to ask questions, and those that sit away in the back are just there for the ride. Don't bother me. I'm just taking notes, and don't bother me. So I get it.
Right.
Exactly. I get it. So that's interesting. That's fun to say. So you mentioned something about, you talk about people, it's just something that intrigued my mind. Why don't people exercise? What is the funniest thing you've heard from someone say that the reason they don't exercise?
Believe it or not, the weather is number one. It's too hot outside. No, sir. I just can't, man. I mean, it's boiling outside, man. Yeah, I just can't do it. It's too cold outside. Are you going to pay my bill if I end up in the hospital with pneumonia and flus and COVIDs? And it just seems that there's always some type of excuse. And like I said, weather always plays a big one. I don't have time. I think at one point we've all have been guilty of that. I don't have time. I don't have time. I'm at work, and then the wife, the children at home, the husband, or whatever it is. A kid's got soccer practice. By the time I get home, I'm exhausted.
Yeah.
So time is also an issue. Also.
So what do you tell them, or what how do you find that breakthrough? Like, what is it that you maybe a certain phrase or line you go to that you can see it really kind of shifts their mindset? Like,
Well, when I explain to them, look, what you put into this program is what you're going to get out. When they tell me that time is their biggest barrier, I said you have to organize your daily schedule. Yeah. All we ask is for 20 to 30 minutes, 5 days out of the week, of physical activity. What is physical activity? Walking, brisk walking, jogging, running on a bicycle, swimming, dancing, jump rope. You don't have to be part of a gym.
Yeah.
You can do this at home. And I always use, it's probably a bad example, but I always use, like people that are in jail, the prisoners. I said, you know, if you see, look at those guys, they're pretty buff. Now, I get it. You know, all they have is time, right?
Yeah. Oh, that was nice. That's all I do.
You know, they're either drawing or asleep or they're working out in their rooms. But my point, it's important enough for them to do it.
Yeah.
Whether it's a pastime, whether it's to get them off how much time they have to do for the rest of their life or whatever their sentence is, but it's important to them. I know because I used to work corrections before I became a nurse. I used to work for a federal prison in Bayview with immigration. So, but how do I keep them, you know, just letting them know, look, what you put into this is what you're going to get out. Because I can be here educating you and pressing you, but at the end of the day, it's up to you. It's like they say that saying, right? You can lead the horse to water, but you can't make him drink. So in the end, you know, it's up to them. I break it down for them where I tell them, look, you know, 40% of this, out of the 100% total control of your diabetes, is going to be your diet. Other 40% is going to be exercise. That's a total of 80. We have 20% more to go. 10% medications. Take your medicines. That's what they're for. And then the last 10% is going to be doctor's office visits.
Checkups.
Total of 100% total control right there. But 80% goes to who? You or me? You as a patient, right? So I kind of explain it to them. I like to break it down where they understand it.
And I think that's a really great way to break it down. Well, I was, again, talking about medication now because you triggered my mind on medication. And I was talking to someone this morning. They were on Ozempic and it wasn't working for them. So now they're on Margino. And I was taking I go, have you changed your behavior in eating? And he's like, why would I? And I said, bro, the medication is not the answer to the problem.
Right.
It's a tool to help you in your health journey.
Absolutely.
And getting people to understand that is really hard.
It's hard.
That concept doesn't fit in.
It's hard, and I'm glad you mentioned that, Moises, because when I put the breakdown of the 100% management on writing on my board, on my blackboard, I make them understand. Look, I put 10% medications that we shouldn't depend on our medicines.
Right.
I said I could have put 80 there, but then that makes you dependent, and it doesn't make you have to do anything anymore. You don't have to do your part because you're expecting your medications to do everything for you, and it doesn't work that way. So. We don't want you to be dependent on your medicine. They're going to work for you, but they're not going to perform miracles either.
Right.
So that's one of the things that I focus on. And when I explain it to them, they're like, man, this guy's firm, you know, but I like it. And they keep coming back. You know, I retain.
Well, we need that. We really do need that. I mean, as I try to be a good patient, but at the same time, I need someone to encourage me, to keep me focused on what the main prize is.
Well, I think, you know, being a diabetes educator, the main thing is you got to be the example. I can't be up there overweight and looking really, really raw because a lot of patients see that the first image, like, how can this guy be teaching me on diabetes if he's overweight himself?
Right.
I hate to say it like that, but that's the way.
It's true.
It's true.
Yeah,
you know, there are people, especially our culture.
Yeah. No, it's true.
We're very, you know,
we're very judgmental. We're very judgmental.
Very judgmental. So, you know, but yeah, and you just, you got to captivate your audience. That's very important.
And it's one of those things that we, oh my God. So when we ask people to come to health fairs, we tell them not to bring candies or sugary beverages or sugary treats to the health fair because what's the purpose of having a health fair, doing A1Cs, blood pressure checks, and then you're giving people junk food for them to get unhealthy. But the thing that bothers me the most on top of that is that a lot of the partners that we work with do have some weight, are obese and whatnot, and then you're talking to a patient who is obese as well, giving them education at a health fair, and they're like, "Well, don't you take the own advice?" It's hard.
Yeah, it is. It is very hard. It is very hard. But that's one of the things that they are looking at.
Yeah.
Unfortunately.
Yeah.
You know, and it's not because it's me, but it's just something that I've learned as a nurse over the course of my career. Is even when I used to work the floor, you know, you'd have patients that would, you know, just make rude comments.
Yeah, they do. You know? Yeah, and unfortunately, we're not stereotyping anyone, and we're not saying this because you can have somebody who's perfectly thin and be super sick, somebody who's considered obese and be perfectly healthy. Yeah. But our bias is already preconceived into our brain that way, you know, and when we have that, so that's one of the things that we try to work with, and we do talk to people when we do the health fairs, and it's like we go talk to the main director or whoever's there, and I said, hey, can you tell everyone to take away their fraps? Yeah. Give them water. I mean, how can you be talking about this and then todos con sus Starbucks?
And that's hard to do. Like I said, I think with, you know, regarding the patients, you got to meet them halfway, you know, and we're not there to, you know, get after anybody. It's more just to bring awareness, education, and just being respectful towards their situation. Once you lose a patient's interest, they're not coming back.
Yeah, and it's really hard. You're right. Once you do someone interest, it's hard. And unlike you, I do like to put the fear factor in people. You're gonna lose your teeth. You're gonna lose your teeth and your vision.
Well, there is, like I do mention to them, look, this, I'm not saying this is going to happen to you, but if you let yourself go and you just say,
That's where you're headed.
That's where it's going to head. It's like street drugs. We know where it takes us, either to jail, 6 feet underground, or you end up dead overdosing.
Yeah. Yeah, and it's really scary, and I think one of the things that we want to probably just focus on real quick now is men's health. How many men do you have in your program? Do you have several men? No men?
Majority of my patients, almost 70-80% are women.
Are women?
Yeah, men, it's very hard to get them in.
Yeah.
One, it's just like that's the machismo kicks
Right,
in.
right.
I don't need it. I already know it. I came to these classes before. Not wanting to. It's again, I think it's the machismo behind that. But women are more reluctant to come. They're the ones that majority of my patients are women.
Yeah, I think we need to focus more on men right now. How the male machismo, the whole model, they're the caregiver, the breadwinner,
Right.
the whole deal. But if they get sick, man, the
Yeah.
whole family comes down.
Oh, for sure.
If they're the
For sure.
main breadwinner.
For sure. Like I said, the young guy, 30, 40 years old, are the ones that are able to come in.
Yeah.
But men, mainly the baby boomers, 50, 60-year-olds, that
Yeah.
just, it's like a buck and bronco, they don't want to come in for a lot of reasons, so those are the ones we struggle with. But majority of my patients are women.
And we try to push people. We've been tending. June has been this June, and all Junes are focused on men's health. And then we've gone to certain events focused just on men.
Yeah.
And just to get guys to answer the CDC questionnaire, they're like, no, I don't want to
Yeah.
know. I don't want to know. I don't
Yeah.
wanna. And they avoid us. They
They do.
avoid our table.
Yeah, yeah. I don't. It has to be a culture thing. For me, mainly, in our culture. I mean, use my father. When he got diagnosed with rectal cancer back in 2005. I mean, this is a very, very old-fashioned man who, was a truck driver, and he just got diagnosed, and it seemed like his whole world closed. He did not start getting treatment till I started pushing him. I took him to MD Anderson. We made appointments, and praise God that he's been cancer-free for almost 13, 14 years
That's
now.
great. That's amazing.
So, but he went through a whole process. You mentioned the family. Once the man gets sick, the whole family suffers.
Right.
And the family suffers emotionally. There's a lot of stressors, bills, stuff like that. So, but I know firsthand because I witnessed it. With my own father.
Yeah, and it's really hard. And then again, you mentioned you pushed your dad, so you obviously filled into a caregiver role instead
Yes.
of the dad being the parent. You filled in that role and saying
Absolutely.
like, I'm the parent now, and you're my child, and we're gonna do this.
Right.
And it's still hard because
It is. I struggled with him, but he gave in and he said, "Okay, son, let's do it." And everything just seemed to fall into place. Now I'm not going to tell you that during that whole entire process that he was getting chemo and radiation and surgeries. I got to tell you, it was tough. It was tough to see your father, who was your hero, who is doing this, and he's unstoppable, unbreakable, and then all of a sudden you find him one day taking a shower in the corner, crying and sobbing. That's tough to see. And this is a man that I never saw once shed a tear. I see him in a corner. I walk in on him, and he's curled up in a little ball. So
it's gonna be tough.
It's tough.
It's tough, and then to make sure that you're giving them the type of attention and
Sure.
love that they need. That way they don't. Because guys, we're just built differently sometimes, and we're built to not cry, not to do this, and not to do that, and so you as the son now seeing that, you have to make sure that you take care of him to make sure, because once a person gets depressed, man, and sick,
it's hard.
They go down.
Yeah, it's hard. It's hard. My dad now, he's 70 years old, so he got diagnosed when he was 50. So
How do you, maybe this is me selfishly asking this since
ahead,
I
Dave.
attend a lot of outreach events, and it is very, especially like Moses was mentioning, since June is Men's Health Awareness Month, I've been attending a lot of these male-centered or male-focused events. How do you find some breakthrough to like reaching out and like stressing to these men like, hey, you do need to take care? Like, what do you use that has helped you?
well, with the older gentleman, the times that I had with them is just, letting them know, look, I know you're a lot older than me. I know you know more than me. and that giving them that respect, it just for some reason it's worked for me. I let them know you're still in control. I am not in control here. You're the boss, and giving them that space and that mutual respect. And then slowly I start infiltrating with, okay, look, in order for this to do this, if you get sick, then you cannot work for your family and you can't do this. So if you want to be able to do all of these things and carry your family along with you, you somehow at some point need to start changing your ways.
Yeah.
And it doesn't have to be cold turkey. You take baby steps.
Yeah.
And I explain it to them in the sense where they understand it and they don't feel so overpressured, to just want to do it. They slowly, gradually change over time. And that's the thing that nobody likes to be told to do. You got to do this right now, or if not. And they're like, hey, man, I'm my own boss. You don't tell me what to do. I take orders from me only. And so I found that works for me, is when I'm reaching that population to that kind of type of patient, I let them know, look, you're in control. This is how we would do things, but at your pace. You know your body more than anybody. I said, I don't want to add extra stressors to you that you already have, but this is something that we're going to work on. And I'm going to help you work on it. I'm a resource. I'm a tool.
Right.
So a lot of reassurance. And I
Right.
think that's what these patients that are fall in the category of the machista, I think that's what they need is reassurance, because I think I attended, I'm not sure, recently, it was some doctor out of Laredo. I think it was with y'all's in Westlaco, I think, here in Westlaco.
For the
There was-
conference?
Yeah, for that
conference?
conference.
Yeah.
There was this cowboy guy.
Yeah.
He gave
Dr. Miranda.
Miranda. I would have never remembered his name, and he gave a
Yeah.
talk about machismo, and I learned a lot from there. And I'm like, man, it's so true, So, and I'm glad that him being so young, understands the culture and stuff like that too. So that helps a lot. But I think that's one of the biggest thing is just reaching out to your patient with a non-judgmental. Not being all gun ho and this is the only way it's done, and if you don't do it this way, I don't think they like that. I think it's bringing up the topic and just planting that seed in them.
Yeah, different strategies for different people,
Yeah.
especially age groups. And I think you
For sure.
mentioned one thing that really, really is key is step by step.
Yeah.
And I tell people right away, don't get on a diet and weigh yourself every day. It's not gonna happen, bro. You didn't gain weight overnight,
Right.
and it's gonna take longer to feel like you're making some progress. And I go, why don't you focus not on the weight, but on the inches you're losing? Because your clothes is gonna feel better and all these things. But I think it's just key what you just said is step by step. And being as a bariatric patient and being a yo-yo dieter for many, many years, and going through the bariatric surgery, and I have some friends who say like you had to mutilate yourself to be able to lose weight. Well, yeah, I did because I had a problem. I love food.
Yeah.
It was my stress food, right? I was
Right.
stressed out. Eat food 24/7. But I think now looking back, and I'm like, man, I see people who apply themselves.
Mm-hmm.
They're disciplined. And they made a lot of life changes without having to do the surgery. And they continued living a healthy life and made those improvements.
Right.
I just didn't have the willpower. I cheated. I had surgery. I cheated. I had surgery.
No, so well on that topic a little bit. So you are an LVN and an educator. You take care of other people for a living. How do you take care of yourself?
Oh.
Do you want to give us maybe some self-maintenance tips, some hacks
Sure,
that you have?
absolutely. Well,
wellness
like I
tips?
mentioned to you guys earlier, I have to be the example, right? That's just me personally. I do run a lot. I jog a lot.
Okay.
I lift a lot of weights, and I've been in the martial art of Brazilian Jiu-Jitsu. I'm actually an instructor myself.
Wow.
I've been doing that art for 14 years now, and it requires a lot of cardio training. But I have to stay healthy for me, as well. I'm going to be 45 in September, and I know some of my friends that are my age that can't even bend down to tie their shoelace. Some of them are complaining of all the body aches and stuff like that. And don't get me wrong, as we age, we're all going to get there. But and 40 in your 40s, 45s, that doesn't seem like you're old, but you're getting up there. Your body's changing as you're getting older. So I don't want to tell myself that I'm getting older. I want to still feel like I'm young. So I push myself, and there's times where I just say, you know what, today I'm not going to do nothing. Then I remind myself of like, no, you have to do something. You can't go a day without at least doing a 10, 15, 20-minute jog. I do a lot of jump roping, a lot of box jumping. I train Brazilian Jiu-Jitsu 3-4 days out of the week for about 2 hours. So there's a lot of cardio training there as well, you know. So it's training the mind, training the body. Although I'm not going to tell you that, you know, my elbows don't hurt, my shoulders don't hurt, my knees don't hurt, but you just kind of roll with the punches. You got to work with those little pains and aches here and there, and I think that's how we keep going. You know, it's Rocky Balboa said it one time. You know, it's not how hard you get hit; it's how hard you get hit, and you're able to get back
Keep
up.
pushing
So
forward.
you keep pushing forward. So
I love that.
yeah, and
That's
eating
awesome.
healthy. You know, eating a lot of salads. You know, eating lean meats. Drinking water.
Touch on that a little bit. Let's. What's your diet like? What's your nutrition like?
Well, for me, I intake a lot of protein because I'm trying to, you know, build muscle as well. So I take in a lot of protein. I have a protein shake in the morning. I'm not a breakfast guy, so I have a protein shake in the morning. For lunch, I kind of eat what I want. I try not to eat the stuff that's the stuff that's out there, but every once in a while I mix it up because I think that if I eat too lean and it's just, I won't fit into the clothes that I normally wear. And
Yeah.
when you got a wife at home and, hey, what are you spending your money on? And you can't be buying new clothes. And so I got to watch that too. So I eat lunch. I pretty much eat whatever I want, but I try to go on the healthier side. Sometimes I'll include a salad and stuff like that. For dinner, I repeat the protein shake. So I have a protein shake in the morning and in the evening. I only eat once a day.
Yeah.
Just for lunch.
And I think with how much physical exercise you do, how much you exert, you can't just, like you're saying, be too strict because then you would lose. Yeah.
I would start to lose muscle mass and
Yeah.
stuff like that. So I just make sure that I eat every food group. You know, I have my fiber with my vegetables, my protein, and I'll have a carb because we need carbohydrates. A lot of people misunderstand. You know, carbohydrates, they're so bad. Yes, they are, but we need a certain amount. It's our gasoline for our bodies.
Yeah.
You know, and in our Hispanic culture, we go back to we just don't need an excessive amount. And that's the problem with our Hispanic culture. You know, we eat too much tortillas, too much rice, too much beans, too much pasta, too much, you know, and that's the foods that get us into trouble.
Yeah.
So.
Yeah, they're great ones.
Yeah, they are. And we're all guilty of it, you know, of eating those foods. But that's kind of what I do. And I take a lot of supplements, you know, to help me. I take a lot of vitamins from GNC, you know, vitamin A, B, C, D, E, K, and all those other, you know, so just to keep in shape too, you know.
And so again, because I know that we're gonna have various listeners listen to us. So Juan is on a very high maintenance. You do a lot of working out, and the reason you do the 2 protein shakes and your meals the way that you do and your supplements is because you are working out. You're very active.
I'm very active.
You're not just sitting at the desk behind all day long and saying, "This is what I got to do. I'm good," right?
Yeah.
Because one of the things that we talked about, the gentleman I was talking about this morning. I said, he's talking about he has his A1Cs, XYZ, and all this stuff, and then I was like, well, bro, you sit down all day long too.
Yeah.
Do you go work out? He goes, I'm brain dead. And I'm like, we're all brain dead when we leave the office. You know, we all been in front of a monitor all day long. It's gonna get tiring.
Correct.
But we need to change our mindset, and I do the same thing you do. Well, actually, I don't. I do 1 protein shake in the morning. I do my meal. I do a protein bar as a snack.
Yeah.
And then I have a lighter meal.
Yeah.
But my problem is I graze after my meal.
That's a good one.
I graze.
Yeah.
I graze. You know what I mean? So we find our way to keep it, right? But you know, it's doing that stuff. But again, I'm not. In the last 3 weeks, I haven't gone to the gym. Back to the gym. I just got lazy.
Yeah. And, you know, sometimes life settles in, you know, as well, too. You got a lot of things going on, you know. But, you know, going back to, I just wanted to say that the reason I also became a diabetes educator, because both of my parents have diabetes. And I have 2 brothers. So I always tell them, guys, you know, like, it's in our gene pool, it's in our DNA, it's in our blood, it's in our family history.
Right.
I said, we got to do everything that in our power to not to have what they have, because statistically it's just the way it is.
Right.
So you may imagine me being a diabetes educator and then me having diabetes myself. It's just, you know, como que no va, you know. But you got to be the example for your patient.
You do, and just like you mentioned right now, it's a lot of the folks that we talk to. It's a rite of passage.
Yeah.
No, it's not a rite of passage.
Yeah.
This is not something that we all have to go through.
Yeah.
And then the other part of the problem that we talk to or we hear from people too is like, we didn't have these, my grandma never had these problems. We didn't have these problems 20, 30 years ago. I go, exactly, because we were all cooking at home, cooking different food, and we were walking everywhere.
Yeah.
Now you want to get from your house to the store next door, you just want to get in your car, even if it's a 5-minute little walk.
Right.
Nobody wants to walk.
Nobody wants to walk. No.
And I get it, but we need to, if we're going to use the car more often or that type of form of transportation, then change your diet too.
Yeah. And you think about it, there's so many restaurants at every corner, and then most of them are fast food. So a lot of people stop by those places, after you get out of work, they just don't want to cook no more.
Don't cook. And I get it. We're tired, man. We're brain dead. But the body still needs something to release, right?
Absolutely.
Cool.
Well, awesome. As we get close to wrapping up here, I do want to ask you a specific question, Mr. Juan.
Yes.
That question being, what does success look like to you? And it doesn't have to be in the professional aspect. Mm-hmm. Just what does it look like to you in your life in general?
Well, success doesn't come through just the first time. I think you have to fail a few times in life to succeed. It's like they say, if you don't, how does the song go, or how does the saying go? If you don't first succeed, keep on trying. Right? So for me, nothing of value, nothing of is doesn't come without working hard and earning it, right? So I think that you have to fail a few times to actually be good at something. And then when you become good at something, you modify it, you put it to where it's supposed to be, and then you build it up to where it's perfect. When it comes to my patients, when I see them graduate from my program, awesome. I feel like I've done something for them. I feel like I've done my duty, my job, my calling. And not just in healthcare, I'm very spiritual too. I'm a Christian, and anybody that I can give advice to, I kind of focus on that too. Putting my spiritual life first, before other things. But going back to patient, that brings a smile on my face to know that I did something for somebody. I helped somebody, not necessarily save a life, but actually got them to where they need to be, because the journey can be long and gruesome. Some of my patients, they drop out halfway in the classes and they just don't come back anymore. And I wonder, what was it that I did wrong? Did I say something wrong? Yeah. Maybe I came off too strong. What did I do? And so for success for me is for me to see and reap the benefits of their decision choices and helping them graduate and just getting ahead of what's already thrown at them, which is their disease process, and them saying, hey, you know what? Thank you so much, for helping me out. My A1C went from a 14.4 to a 6.2. Those type of success stories, I'm like, wow, great job. And then I tell my patients, everything that we learned in 10 weeks, you don't just stop. It's a lifelong, this is for life. Yeah. Because a lot of times patients, they'll do very good during the program, they'll lower their A1C, and then 7 months, 8 months later, their A1C goes back up because they didn't apply what we showed them. So success for me is very important. I think that seals the deal between what you're hired to do, as an educator, which is to promote and put that stuff out there where the patient understands. And then the patient applies it, brings nothing but smiles to my face.
Awesome. And so I really want to thank you for coming on today. I don't know if you got anything else, Moses?
No, thank you. Wrap up? Thank you so much for coming, Juan. We really appreciate you coming by and stopping by. I know you coming from Brownsville, the weather's kind of sucky today and stuff, but it's great just hearing from you and talking about how you live your life, working to improve the lives of those in our community, and that's key, man.
Absolutely. I want to thank Unidos. Thank you, David Moises, for having me on the podcast today. This is something new for me. Like I said, I've seen it done with other people, but I've never actually sat in on one. But it's a pretty cool thing. I like it.
Right. And if there's on that note, if there's anything you want to promote or highlight, feel free.
Well, just that for the community, if you're a Suclinica patient. I work for Suclinica, so if you're a Suclinica patient, we do have programs out there to help you out with diabetes. If you're chronically ill, your A1C's been up pretty high, sign up for classes, go see your doctor, and ask them for that referral to attend our classes. We offer several classes. We offer diabetes self-management education, diabetes prevention. So if you're pre-diabetic, we also have those classes as well. For pre-diabetes, those classes are about a year long. There are 26 sessions. The first 16 sessions are weekly, and then the other sessions after that, 16 through 26, is bi-weekly. And you do have to have a diagnosis of pre-diabetes, and your A1C has to be between 5.7 and 6.4. So I would definitely say not every program, not every clinic or healthcare center has diabetes classes. So Clinica is one of them. And then we are American Diabetes Association certified. So
Awesome.
it took us a lot to get that certification, but a lot of training and a lot of work that got put into putting it in there.
That's great.
Great. Well, thank you so much. And hopefully everyone listening caught all that and they know where to find you and if they do need the help, where to go. And again, thank you so much to all our listeners and thank you for being part of our Unidos Unplugged combo. You guys have a great one. Bye.